This conference will now be recorded.
Am I audible? Visible? Jyoti Prakash?
Yes, sir.
Yeah. Shall we start? Shall we start? So previously we discussed about what are the how RMNCH plus A program has been initiated, where it has been initiated, and how our country has been taking care of this program. Okay, and what are the things that have been implemented through RMNCH plus A? What are all the main objectives of this program, and through how we reach the designated certain goals of this program? Okay, we are in between all these things. So yeah, I already told you the program has been initiated. Global action, call to action. That is child survival call to action. This program has been initiated in a summit in Washington DC, and in our country 2013 they have selected 184 high priority districts, and this program has been implemented through that high priority districts. Later on it has been generalized to entire nation. So discuss. So this is the thing which has been happened previously. So what are all the public-private partnership? That is PPP. This is a short notes for you people. Public-private partnerships. That is what this slide explains about this thing. Then what does it stand for? Reproductive, maternal, newborn, child, and adolescent health. What does that plus indicates? That indicates adolescent people also included this program, which links community and facility based care as well as referrals between various levels of healthcare system. I told you to remember this, the term continuum of care approach through these things. You have to first you have to take care adolescent, then they will be healthy at the reproductive age, then they will be healthy at the pregnant stage, antenatal, during internatal, during delivery. She will deliver a healthy baby. Again, the baby will become healthy towards of his first 5 years of life. Then again adolescent. So these are all the approaches. So these are all the immediate objectives set by the this program developers. So decrease the infant mortality rate to 25 per 1000 by 2017. Then reduce the maternal mortality rate to 100 per 1 lakh population by 2017. Then bringing the total fertility rate to 2.1 by 2017. So this is the process called continuum of care approach. So why we have implemented this program, you know these things. So 5x5 matrix, I explained about these things. In examination also we have to tell this word 5x5 matrix for implementation of RMNCH plus A program. These are all the various types of interventions in a particular life stages, that is in the reproductive age, in maternal health, maternal age, in for newborn health, in child health, and adolescent health. So these are all the minimum essential commodities. This is also we discussed about these things, and we discussed about cross-cutting commodities also. So by 12th 5-year plan, this program has been implemented. So what are all the research has been done in RMNCH plus A? So these are the things which has been implemented and has been under research. That is emergency ongoing care. Right? And the indicators also stated that for various indicators also we have been said these things. Then the preparedness of Public Health Institute for 48 hours of mm, stay. Then comparative of breastfeeding in home, private and public health facilities. Then effectiveness of MCTC in reducing the dropouts. Then success stories in RMNCH plus A, how it has been helpful to the public. Okay, these are all some suggestions. Okay, how they have selected high priority districts. Okay, so based on these indexes. So first they have taken the maternal health indicators. So first thing is obviously maternal mortality ratio, then percentage of safe deliveries. Then in 26 states, the percentage of mothers received at least 3 ANC visits and percentage of safe deliveries. Then high priority districts, based on these things, percentage of children who are fully immunized. So here I have to stress a word called Mission Indradhanush. This is the program which has been implemented to cover all the children who are partially immunized to get them fully immunized. Then total fertility rate also, how the usage of contraceptive devices in this modern period, which is a basket method of this thing. Then percentage of birth of order 3 and above, and by couple protection rate also. This is how these are all the indicators how they have selected 184 high priority districts. Then these are the key steps in district intensification plan. Please do remember, this is the very important how the implementation and intensification of this program has been occurring through all these years since the beginning of the program. So first one is rapid assessment for gap identification. We have to assess the program. Then improving the demand for services. In certain areas, the demand will be very low. There extraordinary setups will be there. Okay, which is of no use. In some areas, there is a intensified demand is there, but the infrastructure is very poor. So that's how we improve the demand for services. In certain areas, the demand will be very high. In certain areas, the demand will be very low. So we have to improvise on demand for the services. Then the health system strengthenings, gap filling and supply chain management. These words are very important. Please do make a note of all these things. You won't get in your textbooks. This slide is very important. Please go through it. Health system strengthening, by which gap filling and supply chain management will be taken care of. Then engagement with the other social sector departments, that is involvement of non-governmental organizations. That means private partnerships. That is what is meant by public-private partnerships. Then concurrent monitoring and supportive supervision. This is a very basic for any program. monitoring and supervision should be there at any cost. Then only the program will be achievable. So without all these things, you cannot implement or support this program. Concurrent monitoring and supportive supervision. These are the 5 key steps in a district intensification and implementation of this RMNCH program. Am I clear? Am I clear? No response.
Yes, sir.
Yes, sir.
Yes, sir.
Very good. Very good. Very good. So yeah. For the first step, rapid assessment for the gap identification. So geographical, epidemiological, socio-cultural identification of the backward blocks. Then assessment of health facilities and outreach functionality. Outreach through functionality, utilization, equity, access, and gender aspects. Then resource mapping exercise in the districts. The development of district action plan with a specific focus on backward blocks. This is for gap identification through rapid assessment. By doing a rapid assessment, all these things will be taken care of. Please make a note in your book. All these things won't be available. Please do make a note of all these things. This is a very simplified manner so that you can keep it in your mind and then reproduce at the time of examination and viva also. Then comes health system strengthening and gap filling. Okay, so how this has been achieved means 30% of higher financial allocation under NRHM. Okay, 30% of the budget will be provided through NRHM. Then relaxation of norms for HR and infrastructure as per guidance of Government of India. Then additional incentives. It's always a better one to improve the standard of the work. In a difficult area allowances, residential facilities. Then accreditation of private institutions and NGO run facilities. Need-based capacity building. The term capacity building is a short notes for you people. Capacity building. Health information gani, health management lo gani, these things are very important. Capacity building and supply chain management. For demand and supply chain should not be broken at any cost. Wherever the demand is there, you people have to supply it. That is the program developers or monitors. Then focusing on the demand for services through behavioral change communication. This is also important short notes for you people. BCC, behavioral change communication. Then engagement with the social sector department through coordinated planning, supervision, and resource sharing. Then concurrent monitoring and supportive supervision. Okay, so this is this constant monitoring through scorecards. I already told you tracking, MCH tracking is through this MCH card. Any female more than 19 years of age, they have to possess this MCH card. This ASHA worker will take any more than 19 years female to the nearby health facilities and the MCH card will be given to her. And from that time till the delivery or all the things will be recorded in that MCH card. This is how we do concurrent monitoring and supportive supervision. and the most thrust should be on the backward blocks, always. So partner support for intensification. So full spectrum of RMNCH plus A interventions to be addressed. Yeah, you know that. Then harmonized managerial and technical support extending beyond the hermetic or organizational expertise. So always we should give our best. So partners to be acting as a catalyst, and then mentors and handhold units, district level units, and field functionaries. Then differential district planning based on gap analysis, innovations in service delivery mechanisms. I already told you to remember the word called delivery points. How they have been classified? Anyone? How delivery points has been classified? I told yesterday. Anyone? What do you mean by delivery points, and on what basis they have been classified, and how they have classified? Yes, anyone? Am I audible?
Yes.
జతి ప్రకాష్ ఒక్కడు కూడా రెస్పాండ్ అవడేంట్రా? డెలివరీ పాయింట్స్ అనగానేమి, దాన్ని ఎన్ని రకాలుగా క్లాసిఫై చేశారు? దట్ ఈస్ మై క్వశ్చన్. సో ఐ హ్యావ్ టు కాల్ ద నేమ్స్. Who is Sumanjali? Roll number 87. Roll number 154. Sai Harishwar. Present or not? Roll number 154. Roll number 85. Yesterday I told you, na, L1, L2, L3 delivery points has been classified into 3 categories, that is L1, L2 and L3. L1 is where minimum of 3 deliveries are taking place. L2 is a setup where more than 10 deliveries has been, minimum of 10 delivery has been taking place and taking care of the complications also. L3 means it's a delivery where more than 30 deliveries is happening along with the surgical interventions like C-section, cesarean section. Please do remember at least now also. So structure for monitoring for this RMNCH plus, that is NRUs, that is a national RMNCH plus A unit. So adhered by in Ministry of Health and Family Welfare, led by Joint Secretary of RCH and assisted by Director General, secretaries who are under District Commissioner and supported by USAID. So consortium of representatives of partner agencies to periodically review this RMNCH progress through of high priority districts in a review meetings, both national, regional, state and district levels. All the review meetings should take place at all the levels, district level, state level, region level and national level. Then only this consortium takes place. So NRUs, that is a national RMNCH plus units, to liaise with state and leading partners and with state governments and with local units and district units, state units, district units for overall implementation and monitoring of RMNC. Please do not worry about all these things. You should know the organization also. From district, then they have to report to the state level. State will report to the regional nodal center. Region nodal center will report to the nation, and the nation will report to the higher authorities, that is UN or UNICEF or this WHO also. This is how the organization takes place. SRUs, that is state level RMNCH units, and these are also led by state lead partners, that is SLP. Same, all these things also. Then district level monitors, then comes the state unified team. Ma, please do remember these side headings. These abbreviations also very, very important. You always repeatedly find these things in coming classes also. So NRUs, SRUs, DLMs, SUTs, all these abbreviations also very, very important. So this SUT to conduct field visits in high priority risk periodically, that is at least once in a month. Then reports takes place. I already told you all the reports will be compiled and will be analyzed by state units and shared with the regional and national units on a monthly basis. Every month a review meeting will take place regarding all these things. So why we have to know all these things means in future you people are the ones who are going to intensify these programs in your areas. Obviously, you people will become a medical officer for certain regions. So we have to take care of all these things. So that means our contributions always matters. So we have to reach out to the nearest district officials, and we should offer our support based on our skills. Then we have to take involve our department also to take the initiatives, and we undertake the research work also. A simple paper is more than enough. Just a heading called how the people are utilizing the RMNCH plus A services in a particular area of particular districts. You can prepare a simple research work. How many people are benefiting, how are benefiting, till how many years they are utilizing these services. By utilizing these services, how their health has been improved, and on what is the outcome of these services. You can prepare a simple research. It is always good. Then identifying the partners, that means private partners, and allocating with them, and we have to offer our skills to their team. They may earn, there may be funding also to keep up our work. And this mail, he is the one he has given to reach out this RMNCH program. So this completes RMNCH plus A. This is how the program has been implementing. Still a lot of research is going on. So always we have to be in a updated manner. Then only we will get a full skills on these things, or full grip on all these programs. Are we clear? Clear so far? Are we clear?
Yes, sir. Yes, sir.
Yes, sir.
Yes, sir. Yes, sir.
Very good,
Yes,
ma'am.
sir.
Very good, very good. సో ఎగ్జామ్స్ లో వస్తే రాయగలరు కదా. వాట్ ఆర్ ద ప్లాన్ స్ట్రాటజీస్ ఫర్ RMNCH plus A, డిస్కస్ బ్రీఫ్లీ అబౌట్ దేర్ ప్రోగ్రామ్ అంటే రాయగలరు కదా. ఇట్స్ a essay notes for you people. essay question ఇది. You have to write all the things. PPT also will be here only. I will ask these people to share this PPT with you. Please go through this PPTs and go through your park textbook. Record all the important points. Then you will be able to write in the examination, and you can do very well in the Viva also. Clear? Then so what are all the other programs have been discussing in other classes? Yes, what are all other programs?